Welcome to the Global Cancer Research Conference, G-CARE 2025, hosted by Vyyoma International, held virtually on October 16th, 2025. This global platform brings together experts in cancer biology, clinical research, emerging technologies, and oncology care to drive impactful scientific progress and shape the future of cancer treatment worldwide.
Where the zero research analyses do not identify any treatment options or causality, parents may proactively seek their child's raw genomic data, defined as sequence reads generated from biospecimens without annotation or interpretation. NHMRC, in fact, states that there is no expectation for its return. Different research groups also take different positions even in the same country. Importantly, in this evolving space, learnings from parents, patients, cancer treating teams will support further refinement of the process.
In 1963, Lytham also isolated zeatin, which is another member of cytokinins, from immature corn kernels. It's important for us also to confirm that in vivo, because if only the in vitro show that and the in vivo not, so it makes no sense. And here, as I explained, how the virus attack the cancer cells and not the normal cells, but just keep in mind that the virus is already replicated more in the cancer cells than the normal cells, and even when it is replicated inside the normal cells.
Explained or placed this interaction between tumors and vasculature is the concept of tumor angiogenesis, and of course, the altered morphologically, microvessels become altered and dysmorphic, and there's prevalent and diagnostically important vias functional consequences, as shown by the clonogenicity assay, which indicates the increase in clonogenicity of cells that have absorbed or uptaken this oncogene.
Immunotherapy is effective for blood cancer patients. The first patient received CAR T therapy still be cancer-free after 10 years. So the first part, we will better understand the immunodynamics of lung cancer as with single-cell RNA sequencing analysis. As a part, in the eyes of pathologists,
cancer is one of the leading causes of death today. It's sobering to realize that 1 in 5 people will encounter cancer during their lifetime. Several methods have been developed for cancer treatment, including chemotherapy, radiation therapy, and surgical intervention. First, I nitrosated the vindalin at position 10 and I reduced it with sodium borohydride, resulting in 10-amino-vindalin. This compound was then coupled with chloracetyl chloride in the presence of potassium carbonate.
The 2021 World Air Quality Report shows that over 90% of the global population lives in areas exceeding WHO PM 2.5 standards. However, current standards, such as China's GB 3838/2002, set strict toxic pollutant limits but prize their ecological protection over cancer risk assessment. This confirms that socioeconomic intensity in the East amplifies environmental exposure and health risks.
Profiles are mostly driven by a large part oncohistone mutations, and EGF receptors of course present, but it's not really a predominant lesions. Some other receptors are involved, PDGF receptor and so on. So the conceptual framework for pediatric tumors is very different. This is our area of our very keen interest, and I'll be very sort of keen on collaborating with people.
If there is absolute awareness of the benefits and potential harms considered, then I think we have to recognize that this data is participants' own data, and they should have control about how it is used.
The synthesized compounds have not yet been investigated, but this is among our future plans. We aim to determine whether the compound affects cell membrane integrity or exert its cytotoxic effect inside the cell. And in the future, we also plan to conduct in vivo experiments.
Healthy individuals, and we will first try it as ex vivo experiments. We will have Siemens and we will try to treat it with kinetin, and we will see the quality of the Siemens and how we will freeze them back and see how they will be, or the quality of the Siemens sample.
G-Care 2025 brought together 79 participants from 13 countries, uniting leading researchers, clinicians, and innovators in oncology. With 12 expert speakers, the event fostered meaningful dialogue across disciplines and borders. This year's program focused on 5 core themes: breakthroughs in immunotherapy, advances in targeted and precision treatments, innovations in radiotherapy, and AI-driven diagnostics. Sessions explored both scientific depth and practical application, highlighting translational solutions, collaborative research, and improved patient outcomes. G-Care 2025 wasn't just a conference. It was a powerful step forward in transforming cancer care. And this momentum will carry forward as we move ahead to G-Care 2026. A new chapter begins. In mid-2026, the global stage opens once again for G-Care 2026, the Global Cancer Research Conference. This edition promises deeper collaboration, bolder ideas, and discoveries that will continue to push the boundaries of cancer research and care. Preparations begin soon. Stay connected and explore more at www.gcareconference.org. Because shaping the future of cancer research starts now, and it starts with all of us.